Could the next global pandemic be closer than we think, spreading silently across borders before we even realize it? What if a former top health official is sounding the alarm, and the world isn't listening? Before we dive into this crucial update, if you want to stay on top of everything happening in US politics and understand the real-world impact of these events, hit that subscribe button right now and leave a like. It genuinely helps this channel grow and ensures you don't miss out on vital information. We're talking about a chilling prediction from none other than Dr. Robert Redfield, the former director of the Centers for Disease Control and Prevention. In a recent statement, Dr. Redfield expressed his deep concern, suggesting that the current Ebola outbreak in Africa is poised to morph into what he described as a very significant pandemic. This isn't just speculation, it's a forecast from someone who has spent decades on the front lines of public health crises. He specifically pointed to the potential for the virus to spread into at least 3 new countries. Tanzania and southern Sudan are cited as primary concerns, with the possibility of further international dissemination. The gravity of this statement cannot be overstated. The Ebola virus is known for its extreme contagiousness and high mortality rate. While past outbreaks have been contained, the idea of it breaching new borders and potentially spreading on a global scale is a terrifying prospect. Dr. Redfield's warning implies that current containment measures may not be sufficient or that the conditions are ripe for a more virulent and widespread transmission. This scenario forces us to confront the reality of our global interconnectedness and how quickly a regional health crisis can escalate into an international emergency. Who is most at risk here? Primarily, the populations in the affected African nations are in the immediate line of fire. However, if this truly becomes a global pandemic, as Dr. Redfield fears, then every nation, including the United States, will be at risk. Our healthcare systems, our economies, and our daily lives could all be profoundly impacted. We've seen the devastating effects of pandemics in recent history, and the thought of facing another one, especially with a virus as potent as Ebola, is a stark reminder of our vulnerabilities. What are the possible outcomes? On the one hand, Dr. Redfield's warning could be a call to action, prompting swift and decisive international cooperation to bolster containment efforts, increase surveillance, and prepare healthcare infrastructures worldwide. This proactive approach could indeed avert a widespread pandemic. On the other hand, if these warnings are not heeded, or if the virus proves more resilient and transmissible than anticipated, we could be looking at a scenario where public health systems are overwhelmed, leading to widespread illness, death, and significant social and economic disruption. The speed at which this outbreak could spread across new countries, as Redfield suggests, is a critical factor. The potential for it to leak into new territories means that even remote areas could be at risk, complicating efforts to track and control the virus. This situation also raises critical questions about the adequacy of global health funding, the effectiveness of international health organizations, and the political will to address these threats before they become catastrophic. The former CDC director's assessment is not just about a virus, it's about our collective preparedness and our ability to respond to existential threats in a coordinated and effective manner. His specific mentions of Tanzania and southern Sudan as potential new hotspots highlight the geographic spread that is a hallmark of a pandemic. The phrase leak into suggests a breakdown in containment, a scenario that public health officials desperately try to prevent. The development of new treatments and vaccines is crucial, but the immediate concern is rapid spread. If this Ebola outbreak becomes a very significant pandemic, the world will be facing a monumental challenge, one that requires immediate and sustained attention from governments, health organizations, and individuals alike. It's a wake-up call for us all to understand the potential for infectious diseases to disrupt our lives in profound ways, and the importance of heeding the warnings from those with the expertise to foresee these dangers. So, what do you think about this dire prediction from a former CDC director? Is this the warning we needed to finally take global pandemic preparedness seriously? Or are we overreacting to a localized threat? Drop your opinion in the comments below. I read every single one. This is a developing story, and we will continue to monitor the situation closely, providing you with the most accurate and up-to-date information as it becomes available. Stay informed, stay vigilant.